It could,
Yeah, it's a CL, but it's an ACL. No, it's yeah. So basically, what happens is the lateral collateral complex is so we used to say lateral collateral ligament, kind of gotten away from that. Now we'll say the lateral collateral complex. The lateral collateral ligament proper is probably the now I have to get off 10 or I can't advance my. There we go. Uh, is the fibular collateral ligament, but there's some other structures that are involved in that. Sagan fracture is actually probably what they think now is pulled off by a new ligament that people just started talking about in 2013, so it's relatively new. It's called the anterior lateral ligament, and basically it's a thickening of the capsule. And if you're familiar with shoulder anatomy, all of the glenohumeral ligaments are basically just thickened bands within the joint capsule itself. And so this is kind of the same thing in the knee. There's this I don't think I have a picture of it here on the next slide. There's a ligament that comes down, and here it may be disrupted, but basically it attaches here. This is the bottom part of this ligament, and it comes up and attaches here. So it's the only thing that we can see on MR that other than capsule that attaches laterally the femur to the tibia, and so it's what pops off this second. It's what actually avulses this off, and it's the ALL, anterior lateral ligament. Um, and it was found on cadaver studies when an orthopedic surgeon was looking at the structural integrity of the knee with a pivot shift injury, which is what causes the ACL when somebody twists their knee with a planted foot. It usually tears the ACL, and it puts a lot of stress on the lateral structures. And they found that there was this ligament that seemed to attach to this spot on the tibia that kind of popped off the little piece that we call a Sagan fracture. And so this uh, structure is now looked at kind of specifically on the MRs sometimes to see if it's intact, because if this anterior lateral ligament is disrupted, then they have less stability in their knee joint. I don't know that they're doing anything about it surgical wise, but it's just another indicator. And that's what happens on the X-ray is that anterior lateral ligament comes here, just kind of pops that off at the shift. And our lateral collateral structures going from anterior to posterior, we have this is posterior, but uh, yeah, here's and we're anterior. So we're more anterior on a coronal imaging. So the IT band comes down and attaches. Then directly behind that, we have the ALL that comes down and attaches. And if we go posterior to that, we have the fibular collateral ligament, which is what most people say when they say the LCL, lateral collateral ligament. That's what they're talking about, is the fibular collateral. But basically, it goes from the femur down to the head of the fibula. And it's a nice thick ligament that we can see. And the last structure is the biceps femoris tendon, which comes down and it attaches here with the and to the same spot as the fibular collateral ligament. And so this is why we'll also see with ACL injuries, a lot of times we'll see some avulsion lesions off the top of the fibula because these structures will get stressed. So in a pivot shift injury, what happens is the ACL, because of the way that it's wrapped around the PCL, when the knee joint turns and this posterior aspect of the tibia twists forward and hits this aspect of the femur, causing these contusions that we see commonly on pivot shift injuries. Because of that rotation and the way that the ACL is oriented around the PCL, it gets stressed and torn, and then those lateral collateral structures get stressed. And then that's with a pivot shift injury. The other type of injury that tears the ACL is a valgus stress injury, which happens a lot in sports, especially American football. And this person will get hit from the outside, like a direct valgus stress, and it will tear a direct valgus stress, and it will tear the medial structures, because you can imagine if they get hit from this side over here, it widens this part of the joint, and we call it Donahue's unhappy triad, and that'll tear the ACL, the medial meniscus, and the MCL. So two different mechanisms of injuries that common tear the ACL are the pivot shift, which happens more in like football or soccer, and then the valgus stress, which happens a lot of times in football. When somebody will get American football, somebody will get tackled and hit from the outside, or rugby. And so those are our two main things. But here's the ACL. It should follow. This is called Blumenstadt's line, and it's basically the roof inside of the intercondylar space. And the ACL, you should see a nice dark ACL following this line along this exact same trajectory. Where this, we see it's not, it should be this color, nice dark color like this, but it's not. It's kind of intermediate signal. It's kind of ratty, and there's nothing in this space, and so that's where the ACL should be. So you know it's torn. And this is a coronal view. This is the ACL coming up, and it kind of abruptly stops because it's been torn off its proximate attachment. And this is just showing those pivot shift contusions, which I kind of already talked about. And it's a very common mechanism of injury. That is our ACL tear with Sagan fracture, as was expertly described on the X-ray by one of you all. And that's yeah. So if you see that Sagan fracture, you want to get an MRI to assess ACL tear, and that's that. And that actually is my last case. It's like we almost used all the time up. Does anybody have any questions about anything?
Probably not.
Good.
So everyone understands.
Good. Perfect. That's the way we like it.
So, hey, thank you everyone for joining us today. So it was a mistake. I did not record it, but I have the last quarter of this record. If you want to see it again, I will upload it in the YouTube. So I can send the link to your email if you want to watch it. And also Carol's session, Dr. Gear's session is also in the YouTube already. And I send the YouTube link to your email. And today, I think we are done for today. Jason, thank you so much.
Of course. Yeah, it's great. It's fun.
Thank you, thank you. Okay, we'll see you next week. Not next week. We will have a AREP lecture, lung cancer screening. So we'll see you next week on Sunday. If you are available, it's gonna be a fun session because Dr. Chais is a pioneer in lung cancer screening of the United States. So she will be our guest speaker.
Yeah, she's very smart.
Yeah. Okay. All right. Thank you, everyone.
Thank you.
Bye
Bye.
now.